Hi, my name's Lucy and I'm a third year adult nurse. I'm also on the nurse sub committee for my university. I'm a member of the We Student Nurse team and I am on the RCN Students Committee. I say yes to everything. For me, the COVID situation has brought about some things that I didn't really expect. I have health conditions myself and I was shielding, which led to more or less a year off with no placements. While a lot of my friends were out deployed and being paid, I was stuck at home, safe at home, but still feeling a lot of guilt and feeling like I could help, so I should be helping. I also had an issue that because I was off placement for so long, my self-confidence really dropped. I finished my second year placements just in time for me to be able to progress onto third year. I'd been told I'd have to take a leave of absence if it didn't get done before the January after September for my third year started. I didn't feel like that placement went particularly well for me. It went okay, but I didn't feel like I was performing at my best. Then when it was time for me to go out on placement again, or coming up to the time, I found that I had really intense imposter syndrome, and I felt like I didn't know enough, or even that I didn't know anything, that maybe I'd forgotten everything I did know, that I couldn't do it, that how could I ever be a proper registered nurse. And I felt like the level of my theory compared to the level of my practice really contributed to that. At the time when I started the placement, I had pretty much finished all of the theory for third year, but this was still my first third year placement. And that was a real clash. We were learning about leadership and I was sort of like, well, how can I be a leader? I don't even know what I'm doing myself. How can I tell someone else how to do things? And it really made me upset. It was really difficult. I feel like I was quite lucky because I had a really good group of people around me from the things I do with the RCN and with We Student Nurse and with the Nurse Soc, that I had people I could talk to, and that helped, but it was still really difficult to shut up that little voice that was saying you are not good enough. And ultimately it came down to kind of getting out there and showing myself, look, you can do it. And even placement is going a lot better now. I still wouldn't say I'm 100% satisfied and confident, but it is definitely a mile away from where I was before I started.
Lucy spoke to us about how she was struggling with imposter syndrome. Imposter syndrome is that feeling you aren't good enough, or when you're given an opportunity and you worry that people will eventually find out that you're a fraud. You may be wondering how imposter syndrome relates to leadership. Well, imposter syndrome can be a barrier to leadership as it's associated with behaviours such as perfectionism or overworking, where we set ourselves unrealistic challenges to prove that we are worthy of that seat at the table, where we work relentlessly, but it leaves us feeling burnt out and constantly anxious. This can happen with our academic work or while we're on placement. So, how can we stop this from happening? Well, as Lucy said, we can break the silence. Shame often prevents us from opening up about our feelings, but by doing so can be tremendously freeing, by knowing that we are not alone in how we feel. And it might encourage others to share their feelings too. It is also essential to separate feeling from fact. As Lucy said, she felt stupid. But what is important to remember is that it doesn't mean that she is stupid. We must also think about the positives. Henry Ford once said, "Failure is only the opportunity to begin again more intelligently." Rather than focusing on failure or the fear of failure, think about it as an opportunity for improvement and learning. So the next time you're feeling like you aren't good enough, why not separate the feelings from the facts? Write down why you're good enough, and then write down why you think you've been given this opportunity. And if you're struggling, why not reach out to your peers, like Lucy did, and ask for their help?